Hi friends, my kiddo is having a tonsillectomy and adenoidectomy, also known as the TNA. And like any parent, I wanted to know, what does the research actually say about helping kids recover faster? Into the studies, and here's what I found. TNA is one of the most common surgeries in kids. It's done to reduce chronic throat infections, treat snoring or sleep apnea, or help with swallowing or tonsil stones. So for us, it was actually the sleep apnea. We had a sleep study done and found out that he had that. Looking at the research, there was a study in 1995 that was a randomized controlled trial with 97 kids. They split the kids up into two groups. One was told to stick to a soft diet and plenty of rest, and the other was told to eat normally and encourage regular activity as tolerated. And they found no difference in recovery time, pain levels, or complications between the two groups. So this study suggests that restriction after the surgery may not be needed. Then in a 2020 study, which followed 827 kids after their surgery, this is a prospective observational study that tracked how the kids did over time. They found that pain usually peaked between days 3 to 5. And most kids were back to normal after the 2-week mark. And of course, 75% of the kids had changes in behavior. Clinginess, mood swings, irritability improve over time. So it's good to know, to expect that, very drastic change in behavior. A 2015 pain management review on pediatric tonsillectomy emphasized something really important, which is that research shows that scheduled dosing for pain medication, not just as needed dosing, works a lot better, and it keeps the pain under control before it escalates. So based on the studies and what I learned from other parents, this is what we're going to do. Give pain meds on a schedule, even if they seem okay. Set an alarm or use a medication tracker, at least doing this for a week to make sure we stay on top of the pain. Hydration is key, so we're going to offer liquids every 30 minutes to keep the throat moist. Cold water especially is soothing. And dehydration is actually one of the most common reasons kids end up back in the ER after their surgery. And one mom shared a great tip, which is to use a clear spray bottle for the kids to spray in their mouth and keep their throat moist if they don't want to sip water. But we actually got him these cute little cups with his favorite characters to encourage him to drink more. And 1995 study says there were no differences between the two groups. We're going to encourage lots of rest just to be cautious and decrease the chances of bleeding. Lastly, we're going to be really patient with him. Pain levels after getting the tonsils removed is really high. Let me know if you have any questions or what you've done different to prepare for a tonsillectomy.